Hello. Well, you've had another great week. I wanted to touch bases and share some information with you about the past week's topic and the upcoming week. So first, just a few comments about domestic violence. This clearly was a topic that really sparked your interest as nurses and women. I can see that you all clearly will be advocating for these patients. It was good to see some of the discussion not being just about women, which was important because men can be and are victims of domestic violence as well, especially certain populations like gay men. And they have less resources. They're not allowed in shelters and they're turned away many of the resources. So it's very much geared towards women, which the resources for women are very important as well. I'd like to share a website with you. I'll post it in the announcements, and it is about Title IX. It's from the U.S. Department of Education, Title IX. I think you'll find it helpful in any area of nursing that you're working. Safety is really important, and as a nurse in a hospital setting, my personal experience, we used to bring victims of domestic violence to the bathroom away from the abuser because a lot of times they were very clingy. They were right there. They wouldn't let the victim out of their sight. But we would get creative and get information to them by writing numbers like inside their shoes or inside like a clothes tag, somewhere where the abuser couldn't find it. So when they were ready to leave, they had that information. As a professor and now director in the academic setting, there are other resources for students, across campus, and they're readily available. However, I still have to get creative at times to get information and access to resources for these students, such as fake meetings, sending them an email saying that I need to speak with them about something academic is important. Safety really is a big concern, and for the victim, once a decision is made to leave that person, resources must be in place for them. And I did mention a lot about in some of my comments to you about making sure as nurses you talk about having a plan and thinking about the details of that plan, setting them up for success, successfully being on their own. And not having to go back, feeling like they have to go back. The second thing I want to talk about is the opioid crisis, and I'm going to provide another link for you website. It's from the U.S. Department of Health and Human Services, and it just talks about what is the opioid epidemic. There are just so many problems that the opioid crisis causes for individuals in society. You did another great job in addressing this in your written papers. One of the issues you touched on is discrimination in this population in healthcare. Healthcare providers, nurses, physicians, etc. can get hardened to the constant abuse of the healthcare system by patients with addiction. And yes, there's often repeat entrance into the system, the ER, physician's office, etc., due to drug seeking. However, we must treat the patient and believe what they're saying. I have personally seen providers thinking that the patient was drug seeking, but thankfully that care was still provided in a professional manner because they did have real medical problems that were identified. We also have to work together to help manage the patient with addiction differently, especially with pain management. So we must believe that a patient is having pain when they say that they're having pain. The problem with this population comes with the management of that pain. It's really more difficult to manage because of the high abuse of different substances that, what ends up happening is we have to give them higher doses of a medication to control their pain that could kill, the average person that is not drug addicted. We have to remember that their pain is just as real as ours, and you must advocate for patients and try to manage their pain in other ways. And sometimes it means getting more creative and more involved with the physician in trying to manage that pain, something that's not going to give them that quick, high, that quick, euphoria, but rather something that's going to give them that steady pain management. So the next thing you have coming up is disparities in vulnerable populations for this week, and you'll be identifying what the vulnerable populations are. You get to, pick one of the vulnerable populations and really dive into what some of the deficiencies are of these vulnerable populations. I would recommend picking a population that is of interest to you and maybe where you're working that you're seeing, because that's only going to help enhance the care that you're providing. Well, that's all I have for this week. Again, keep up the great work that you're doing, and don't hesitate to reach out if you have any questions, concerns, and just know that I'm here for you with whatever you need. Thanks, and have a great week.